I think it's really important, and I'm very excited to be here today and be working with you because I think it's so important for nature to take care of us as people and for people to take care of nature. Because if one of those links is missing, then we lose nature, and unfortunately, then our health declines also.
Hey all, let's start with our wild guess trivia segment. The answer to last episode's question about which ecosystem provides most of the air we breathe? The oceans. In fact, the oceans provide more than half of Earth's oxygen. Now, here's today's wild guess question. Trees have many positive benefits for people's health, including by increasing air circulation through a process in which they exhale water through their leaves. What's the name of that process? Drop your best guesses in the comments section of this episode on YouTube or Spotify. One lucky responder will get a WWF t-shirt as a prize. And listen to our next episode to find out the right answer. Welcome to Nature Breaking, a podcast produced by World Wildlife Fund. I'm Seth Larson, and if you're like me, staying healthy both mentally and physically is a big priority. For years, studies have indicated that time spent in nature can bring real health benefits to people. WWF's own Forests and Health Initiative is working to grow the ways we can collectively act on this relationship because, as an initiative report summarized a few years ago, exposure to forest environments can provide benefits that positively affect the body's immune system, blood pressure, heart rate, blood glucose, and stress hormones. We're not here to argue that a tree a day will keep the doctor away. Modern medicine and medical techniques remain essential, but the fact that there's a connection between our emotional health and the amount of time we spend in nature is certainly worth exploring. To help us do that today, I'll be joined by Dr. Stacy Beller Stryer, Associate Medical Director of Park RX America. Dr. Beller Stryer will walk us through some of the specific ways that nature can contribute to a healthier community, and she'll break down the concept of a nature prescription. With nature under threat from things like deforestation, plastic pollution, and more, I hope today's episode will make clear that if we all want to keep deriving health benefits from nature, then nature needs us now to take action. Before we begin, please be sure to hit those like and subscribe buttons on YouTube, Spotify, Apple Podcasts, and other platforms. Now, here's my conversation with Dr. Beller Stryer. All right, Dr. Stacy Beller Stryer, welcome to Nature Breaking. I'm so glad to have you here today.
Thank you very much. I'm excited to be here.
Yeah, so I want to get started by helping our audience understand a little bit about your background and your expertise on this topic and sort of what brought you into it. So you're a pediatrician, right? And I'd love for you to tell us a little about your background and how you got involved and interested in the link between nature and human well-being.
That's a great question. So I have always been a lover of nature ever since I was very small. I'd be the person who was outside making acorn soup and, forts outside in my front yard, swimming in trash cans. I just never wanted to come inside. So I've always been aware at how important nature is for me and how much it helps me both mentally and physical. And I never really recognized that everybody needed nature until about 14 years ago. I went to an American Academy of Pediatrics conference and heard Richard Louv, who's the author of Last Child in the Woods, speak about how important nature is for children and how the lack of nature is really increasing the incidence of a lot of chronic health conditions. And how not only is it increasing the risk of chronic health conditions, but it's decreasing the love of nature and stewardship with nature. And at that point, I realized that nature isn't just important for me and for, a few million other people, but that it's a necessity for everybody.
Yeah. Okay, so that was 14 years ago, and now you're involved with this great organization, Park RX America. I'd love for you to talk a little bit about that organization, what it is, what it does, and how you got involved in it.
So I got involved about 8 years ago. I had decided that I wanted to combine my love of nature with my passion for healthcare and improving the health of individuals. So when I finally had time, my children had left the house, I decided I wanted to look for an organization that combined the two. And through doing research, I found Park RX America, which combines both nature and health of individuals.
Interesting. And so I'm learning about Park RX America, and in the process of preparing for this interview, I know one of the big things that the organization is advocating for are nature prescriptions. And I'd love for you to tell our audience a little bit about what that is, because I think a lot of us can make an educated guess based on the name, but it's a relatively new concept, I think. Where did it come from and how does it work?
So several years ago, a lot of different organizations started wanting to find ways to increase outdoor time in order to improve the health of individuals. And a group came together to talk about ways to do it. And that's how nature prescriptions came into existence. And our organization does many things, but one of the main things we do is we provide a platform or a way for healthcare providers to write prescriptions for individuals to get out into nature to improve their health, both mental and physical.
Okay, so talk me through the science of this a little bit more. What do we know about how nature actually improves our health? What's the research that's gone into it? I'd love if you could break down any citations or scientific papers that have really illuminated what the connection is, how it works. Is there something about our brain chemistry that gets activated when we're out in a forest? And how do we really measure that?
Those are a lot of questions.
Sorry.
I could probably talk about that
yeah.
for hours. There has been a lot of research done over the years and over the past couple of decades, and it's getting better and better because nature and being outdoors helps in so many different ways. There are a lot of different studies that have been going on. We look at physical health. We look at, improvements in diabetes, hypertension, weight control. And then we look at anxiety, depression, and now this new phenomenon, loneliness.
Yeah.
And the studies, just one example, is studies that have been done on Shinrin-yoku, which is forest bathing out in Japan and then Korea and now in many areas throughout the world.
Forest bathing.
Forest
Does that
bathing
just involve just immersing yourself in a forest?
Yes, actually it does. And they actually have certified forests, not in America, but in Asia, where there's a variety of trees and a variety of different settings. And there are studies that are done before you start your forest bathing session. So before you go into the forest and you just spend all your time just almost meditating in the forest and walking through it and looking at various aspects of it. And then you finish your forest bathing session and they've seen improvements in heart rate and blood pressure, in measurement of cortisol levels, which is a measure of stress. It's like a stress response. And they've even seen improvements in what they call NK cells, which are natural killer cells of the immune system that kind of survey our body for cancer and for other sorts of immune issues, and they see improvements in all of this.
That's so interesting. I think anybody who grew up around nature or who has spent time in nature as an adult probably intuitively understands that this all makes sense. It's not a huge surprise that you would feel that you do feel more relaxed when you go into nature, right? People go on vacation and they seek out national parks and places like that because they want to be in that surrounding where it's peaceful and their stress levels can go down. But it's one thing to just be observing those things that we maybe all thought were true without really ever thinking too much about them. But the fact that we're able to really measure and see those changes taking place and then apply them to medicine is fascinating. So how are nature prescriptions then calculated? So there's this body of evidence that cortisol levels, stress, all these things are affected by being in nature. A prescription, when I think of a prescription, there's always an amount involved, right? I had a sinus infection a few weeks ago. I had to get a prescription, and it was so many milligrams and twice a day. And how does a nature prescription work? And how do you take account of someone's symptoms, whether it's mental health and stress or a physical health ailment, and how do you then apply a nature prescription to address that?
Sure, those are good questions, and I think the first two things are that one, the amount of time in nature There are studies that show, how much nature do you need in order to improve your health? Well, health is such a general concept, as I mentioned before. Are we talking, mental health, physical health, and it varies. And I think the answer isn't known. The largest study was done in the United Kingdom several years ago with over 19,000 participants in a survey. And they found that you needed at least 120 minutes a week of time outdoors to improve your general sense of well-being.
Okay.
It could all be once a week, or it could be multiple times during the week, as long as it met that threshold. There are other studies that show, you need one walk outdoors in a garden for 20 to 30 minutes to decrease your cortisol levels or decrease anxiety. So there are a lot of different studies. We don't know the exact amount of time needed. When we issue or we talk about nature prescriptions, we try to get somebody out on a regular basis every week. Is it 2 times a week, 3 times a week? We speak with the person we're writing the prescription for. Let's say it's for anxiety. It may not be that they want to go walking. They may just need to sit down in the garden and relax and think of nothing. So we speak with each person about what issue they're dealing with, and we talk to them about what they think would help them. Mm-hmm. And then we find with them what particular place do they feel safe going to that's close. When can they do it? Is it Monday and Wednesday after work, and how long can they do it?
Yeah, and when you talk about where they can go, that makes me think of probably a really important point and something you really have to think about in these situations, because everyone's access to nature is going to be different. Some people might live in a densely forested area and they can go on a nature hike in the woods and not see a shred of society and really feel at peace. But other people might live in an urban area. We're in the middle of Washington, D.C. right now. But even in urban areas, you can still find city parks. There's lots of ways to get closer to nature, but that's going to look different for everyone, right? And does that come into account when you're writing these prescriptions?
Completely. Yes. In fact, we used to call our prescriptions park prescriptions and switched it to nature prescriptions because not everybody has access to a park nearby or feels comfortable going to a park. So that's the whole reason. We're very aware of that. And we teach people all the time how to write nature prescriptions. And that is like one of our main points. Not everybody has access. Not everybody feels safe. Every person's prescription is unique, and you need to talk to them about where they can go.
Yeah. And so you're a pediatrician. I'm wondering if you have found a difference between how time in nature affects kids versus adults. Is it equally beneficial in both cases? Is there something more acute and special about a developing kid's brain? There's so many differences in the way we write prescriptions and medical advice for kids compared to adults. Is it the same here, or is it kind of the same for everybody?
It's a good question. I haven't seen any research or any data on the differences. I can tell you that when children in school have outdoor classrooms and outdoor time, they're especially like in Head Start or the younger programs, Head Start and younger programs, their socialization is better. They then, when they get back into class, are able to concentrate better. Children who have attention deficit disorder and are outdoors and have access to green space during recess do much better when they go back indoors. So when you're talking about that developmental period, there are a lot of benefits for children to being outdoors.
I'd love, if you can, to share an example or two of a patient who's been helped by a nature prescription. Understanding, obviously, you can't divulge names. There's all sorts of rules around that sort of stuff. But can you help give us a picture of what this looks like in practice?
Sure. So I have several examples, but one, I think, really good example is a woman who came, or a teenage girl who was in a very stressful family situation, and she had to take care of her younger siblings. She had just the whole family was very stressed with employment and other issues. And she started developing headaches and stomach aches, and she was always very irritable. And she ended up going to the ER a couple of times because of all her issues, wasn't sure what was going on. And so Dr. Czar, who is the founder of PRA, had written her a nature prescription. and spoke with her and decided that her prescription was going to be spending an hour a week in a hammock at her uncle's house without anybody bothering her, no cell phone, no other electronics. And over time, her headaches went away, her stomach aches went away, and she became much less irritable. And she attributed it to the nature prescription that was issued to her.
Wow, interesting. Yeah, that's an interesting follow-up question. How do you sort out attribution? Because I'm sure she was pursuing other treatments as well.
So I don't know if she was pursuing other treatments, but I think I also like to talk about the fact that we are not recommending outdoor therapy and nature therapy as the only therapy.
Yeah.
Hopefully over time it will be the only therapy, but we do it in conjunction with whatever medication is prescribed or anything else. It works well as a combination of therapies.
So PRA is really sort of at the forefront of advocating for nature prescriptions and how beneficial they can be. I imagine you're working with other doctors around the country to help educate them about the role that nature prescriptions can play alongside other treatments. I'm wondering how that process works when you're interacting with other physicians and encouraging them to use this. Is there a standard process you have for training other physicians to start using nature prescriptions in their practices? What's the rollout process look like of getting this into the medical ecosystem, for lack of a better term?
So our website is free to use. We usually will give talks and continuing medical education courses and podcasts like this one. Physicians who are interested in writing nature prescriptions and who hear about that tend to go on our website and then they register. Mm-hmm. And there's a video that talks about how you can write nature prescriptions. It's pretty simple. We also, when we give talks or people will contact us, organizations from around the country, we'll give a talk and we'll talk about the benefits of nature, the science behind it, how you write a nature prescription. And on our site, once you register, you can actually write the nature prescription for your patient and then send them reminders by cell phone to fill their prescription. And once they filled their prescription, the healthcare provider can keep track of how often they filled it. So that's the process by which we do it. And we get contacted all the time by people around the country who are wanting to start nature prescription programs.
Interesting. And what's the response been like from patients and providers that you're working with? Are people surprised when you suggest a nature prescription?
I think that some patients really love it. They love something that's completely different from what they've heard about in the past.
Yeah.
And that's exciting. The providers really like it. However, I'll do a caveat.
Sure.
Providers are very busy. Mm-hmm. And we have almost 2,000 providers who have registered on our site and many other programs around the country. Yet, I wish I could say almost all of them write nature prescriptions on a regular basis, but they don't because they get so busy and have such limited time. So while they're very passionate about health and being outdoors in nature, translating that into writing nature prescriptions is a different story.
Yeah.
And Robert and I have been doing research on that, on how do we, what are the characteristics of providers who are more likely to issue the nature prescriptions, and how can we improve upon that rate?
Yeah. Okay. Well, if there's someone listening to this podcast who either might be suffering from an ailment that they're trying to get help with, or has a friend who might be, or a family member, how can people take advantage of this? Should they be going to their physicians and asking for nature prescriptions if they think it might be beneficial? I'd love to hear from you a little more about how people can start accessing these treatments.
So if people are interested in getting their own nature prescription, and I hope many people are because it is very beneficial and easy to do, on our website, which is parkerxamerica.org, there is actually a place where a patient can write their own nature prescription. And so our recommendation is go on the website, fill out your nature prescription. You can print it out or just, put it on your phone and then go see your doctor, show them the prescription, and ask them to work with you. They can then put it in the system and start working with you on that prescription, because you'll want somebody to work with you to tweak it, to make sure it's working, to hold you accountable. And that will not only help you, but it'll help others when they become aware of the organization and how to issue the prescription.
Dr. Beller Stryer, before I let you go, do you have any closing thoughts, anything you'd like our listeners to know who might just be learning about nature prescriptions for the first time?
I think it's really important, and I'm very excited to be here today and be working with you, because I think it's so important for nature to take care of us as people and for people to take care of nature. Because if one of those links is missing, then we lose nature, and unfortunately, then our health declines also.
Yeah. Dr. Beller Stryer, thank you so much for being here today. This is super interesting. It seems like it's a really still relatively new thing that we're incorporating into our medical world, and I appreciate you sharing it with our audience. I look forward to learning more about it myself, and I really appreciate your time today.
Thank you very much.
Thanks again to Dr. Beller Stryer for joining today's episode. There are so many tangible ways that nature contributes to our daily lives. Some of those, like providing clean air and water, are obvious. The health benefits of nature are harder to see, but as we heard today, they can be really profound. I hope this episode helped you better understand the links between your own health and the health of our planet, and together, let's keep building a more sustainable future.